Hello.
Hi, everyone. Welcome to part 1 of our 3-part video series. I'm Helen, in case you missed it in our last video, and this is...
I'm Tia.
So today we're going to be providing a little bit of an overview of what we do at our clinics, the roles that we do, some services and supports that you can connect with if you are, interested and feeling like that's where you are at currently. Our 3-part video series is focused on our addictions services and just the realm of addictions. Part 1 today's is, like I said, on our programs. Part 2 is going to be focused on just the general overview of addictions and what information we felt would be helpful for the community to know. And then the 3rd part is going to be a real focus on gambling addictions and just the various pieces of information tied to gambling specifically. So thank you so much for joining us. Tia and I were just talking that, often when we're in our clinics and meeting with our clients, we're in our offices one-to-one. And I think the misconception possibly that people can have is that, the work we do is always very intense and heavy and serious. And I imagine that can feel really overwhelming for the general public. So it's nice that we have this video series that the foundation was able to support us with this part of our work to share some less intimidating information, get to know us in this way, and just connect with you on a different platform. So Tia, why don't we start with a little bit of your role at our clinic and what you do with us?
Yes, absolutely. So as I mentioned before, I am the adult addictions counselor here at the clinic. There is also a youth addictions counselor that provides support to community services such as schools, those kinds of things. Within the adult addictions role, I work with clients that are wanting to make changes around their substance use. That could be alcohol, substances, and or process addiction. So an example of a process addiction can be gambling, and that's actually the reason why I went to the conference. Was it was a gambling research conference. So I'm very grateful and thankful to the foundation for sending me there. With the clients and being rural, sometimes there's barriers such as like transportation or finances that people aren't able to access the clinic. So with that, I am able to offer services through like virtually or phone. A lot of the rural communities that have limited availability to get to clinics. So that's something that we can offer, as well as I can offer that to the Okotoks, High River, and Diamond Valley clients, as well as if they are wanting support with any change around substances or behaviors.
Yeah, you mentioned before that your title of addictions counselor can sometimes be a challenge in itself. Are you able to speak a little bit to that?
Yeah, so absolutely. So the word addictions can actually be very intimidating for a lot of people. When people hear the word addictions, they sometimes automatically go to the fact that, it has to be dependent or very severe use. So although my title is addictions counselor, I really like to use words like substance use or problematic use because it takes away that stigma around addictions. A lot of people don't feel like if they aren't addicted or to a certain place that they won't access help and support. And that can really help with preventative work, having people come through the clinic or call to access supports in the beginning. This is really specifically with young people as well, because a lot of young people hear that word addiction and they can't associate their use with that. So
yeah, I love that. I think there's been a lot of work and a lot of changes made with mental health and breaking down the barrier with stigmas attached to having mental health challenges. But I do feel like, and this is just my personal perspective, that there hasn't been as much work to break down the stigmas attached to addictions. I think sometimes when people hear the word addictions, they think that they need to be, street entrenched and that, they're really in the thick of things with addictions, or what you think of sometimes like Hollywood portraying addictions to be, when in fact it can just be that if you question if you're having issues with substances or behaviors, those process related addictions, that that might be enough to get some support or actually look into it.
Yeah.
I also know that for addictions, it can be self-identified, that you have to get to a place where you're recognizing, okay, like I think I'm having some issues, and the title of addictions can be a barrier to getting to that place of self-reflection yourself.
Yeah. So it's really about recognizing, is there harm that's being created by my substance use, my alcohol use, gambling, or anything like that? Or if even just education and awareness, I just want to know like what is out there and what can I do to even limit my use or alcohol use, so it's more social rather than like misuse or problematic. So those are like those things that we can have conversations around. Addictions counseling doesn't mean that you're going straight to an inpatient treatment program, which a lot of people think, and that's more a myth. And that's I'm always working with people in regards to where they're at and what their needs are.
Yeah, I remember when I was working as a therapist and I would try to introduce the idea of addictions counselors, I had to sometimes use different languaging just to be really respectful of the stigma and of the hard work and delicate, vulnerable work that you and our other addictions counselors do as well, because there is that stigma component. I also think with that, it's just important for me to say that, addictions counselor can sound really intimidating, but you're like the least intimidating person I know, like on our team. You and our other addictions counselor too are so personable. And even in these few minutes of this video, what I've heard is you're wanting to meet the person where they're at, work with the person. I love the virtual piece because sometimes, in the addictions realm, if your addictions doesn't allow you to be as consistent with your appointments in person, that we're here to help genuinely, where we do have resources like virtual access or telephone access, although it's not ideal, but the messaging, is that we want to work with you and we want to meet you and help you to help yourself, really.
I think the big thing is if our door isn't the right door, I'm going to support, and the other therapists and counselors here will support you in finding the door that is a fit for you. So whether that's mental health or another program or anything like that, that's something that we can support you with. So just because you don't know doesn't mean that you shouldn't be accessing support. There's no exclusion to our services.
So I was just going to ask that, who, wouldn't you expect to come, or who isn't, allowed to come, or what's the inclusion exclusion criteria?
Yeah, so the inclusion is if anyone is really having a desire to make changes around their behaviors or their substance use, then that is enough to be able to make the phone call and start to inquire if these services would be a fit for you, because I work within a continuum of use and services. So I fit where your goals and your desires at with the treatment plan. So someone might come through the door wanting to just reduce their use, or they want to completely abstain. So it's always I'm working with that client to fit the services and the treatment plan based on those goals and those desires.
Amazing. Yeah. So if anybody wants to connect with you, if they question, even if they do need to start getting some substance use support, connected with you or another addictions counselor, another addictions program, Access Mental Health would be a good place to start. Give them a call. You can expect that they'll do about a 20-30 minute screener just to help identify and assess what is actually going on for you. From there, they'll take that information, pass it on to where they think the best support would be for you, what referral would make the most sense for you. It may be us, other addictions related programs. And from there, we'll, connect and see how we can best support you.
Thank you.
Thank you so much.